Hey, welcome to a great show. This is Law 2020, bringing law into focus. Law 2020 is brought to you by your friends at the BCN Law Firm. That's right, Boyette, Cummins, and Nalos. You can always reach them at 855-LAW-2020. That's 855-LAW. That would be 529-2020. So 855-529-2020 or BCNLawFirm.com, BCNLawFirm.com. Wade Boyette, he is our anchor today, and he has a very special guest with him. Wade, how you doing today?
I'm doing wonderful. Had a great weekend. Had a birthday on Friday, so I've been, having a good couple of days.
I'm liking it.
About to get time to get back to the real life and normal. So it's nice. I'm enjoying being here today on a Sunday. It's a beautiful day outside, so it's nice to be here at the show.
Perfect day. And your brackets are doing how well in the in basketball?
No, I'm not going to win that $1 billion prize out there. But
man, there have been some upsets, haven't they?
Yes, and that's what makes this time of year with basketball so fun. It is almost impossible. When you're dealing with college athletics, watching some of the kids come out and they play with their heart, and anything can happen.
Boy, they are knocking each other around out there. There was like some cage wrestling the other day in one of those games. Them knocking each other down. It was great. But it's fun, and it's on every channel. That's right. Those of you that are used to things on TNT and TBS, forget it. Not this week. All the channels are basketball. All right, you have a very special guest today and a very intriguing topic, and one that the news kind of flirts with every now and then, but boy, then they run away from it because it's controversial, but it is really, when you look at the future, it really holds a lot of possibilities for people who could really need it. So tell us who you brought with you.
I brought Dr. Julio Paez. We are a full-service law firm, so we deal in a lot of different areas, and we'll deal in the personal injury area. We represent a lot of athletes in business law, and we build a team of professionals that we enjoy working with that are the best in their industry, and we have the pleasure of working with Dr. Paez and his partner, Dr. Serenita. They're unbelievable. They own South Lake Pain Institute, and they represent a lot of our clients. And one of the things that he's been intriguing me lately with is stem cell therapy. And I've been fascinated with it, and I asked him if he would come on and do a show on stem cell therapy, really to educate our listening audience about the new technology that's out there.
Doctor, the strides that are being made are not being really advertised or promoted anywhere that you can find. But I ran into a group the other day that is trying to really promote through the VA that some of these guys coming back from Afghanistan, coming back from Iraq, and, they need some help. And it's available to them if medical science would just say, okay, let's do it.
Well, yeah, that's a good point. Stem cells nowadays is available to a small group of people that can afford it or have access to some of the hospitals and institutions that are doing research. Otherwise, it's out of reach for a lot of people. But we at South Lake are trying to make it very much available to everybody with a reasonable price, a reasonable procedure, short, and we've had good success. I'll tell you how we started. I was approached by an individual with ALS, Lou Gehrig's disease, and they asked me if I could inject his spine, his intrathecal spine, which is the fluid that bathes the brain. So put a needle all the way into that fluid so the stem cells would migrate into the brain. And I must be honest, I was scared with the proposition. I said, I don't know enough about this. So that started my research. And at the time, they wanted me to inject him with what's called embryonic stem cells. In other words, they come from somebody else. Those are when they're harvested when women are delivering their babies, so they'll take it from the umbilical cord area and the placental area. And I wasn't comfortable doing that, so I did my research and established that the safest way is to harvest it from the patient's own cells. So I went and I studied. I did some research. I took some classes. I flew away for a conference. I met with the owners of the company that I selected I was going to work with. I admired their work ethic, the research they're putting behind their company, and we started doing it. So I called this individual back and I said, I'm ready for you now. We're not going to do it how it was initially presented, but we're going to do it the correct way. So this poor guy with ALS, we took his stem cells out of his bone marrow and gave him intravenous stem cells and put them inside of his spine. We're still following up with him. He's doing remarkably well.
So basically, we're not getting into the political side of the stem cells because you're using their own stem cells.
Well, correct. We're not engaging in growing organs. We're not engaging in taking stem cells and manipulating. I think what the government has a problem with is when the cells are taken out of somebody's body and then taken to a lab to be manipulated. But as long as they never leave the area of care, what we call the point of care, which is my office or my surgical room, then the government has been okay with that so far.
What are some of the successes that you have noted? The person with ALS is a trial patient, but where have you seen this being very, very effective and in use?
Most of the research comes from joint injections. Whenever you have necrosis, when you have degeneration of a joint, an injury that refuses to heal, a bone fracture that refuses to get put together, or simple degenerations of any joint, muscle, or tendon. So injecting that particular area has been successful. There's been demonstrated growth of cartilage for somebody who has a bad knee. The subsequent MRIs after the injection have shown that the cartilage will grow, that a tendon will heal faster, that the muscle will heal faster. So we're very fascinated by this. In my area of expertise, in addition to all the joints, we also have the ability to put needles into the spine. So we're using it for issues with the sacroiliac joints, facet joints, spine, people with surgery, people with bad discs. And so for us,
wow,
we have a little more areas to inject.
Instead of putting a bunch of metal in your back for back surgery, you might try this as well. Very good. If you got questions about this is very cool. 855-297-9696, 855-297-9696. You could always text us a question at 21232. You know, Wade, you know a lot of people that really get out there, and they're not just weekend warriors. These are people that work out 5, 6, 7 days a week. They're very active. They're doing the cross training. I would think for a lot of those guys that the body sometimes doesn't want to do some of those things.
Especially when you're old like I am.
And now what are you, 22, 23 now? You look so young, I can't believe it.
But yeah, and you're right, Rob. One of my good friends, confidentiality, won't mention names,
Sure.
but they're professional athletes. And on the way over here to the show, we gave them a call because, both of them have little nagging injuries. And it's perfect. They can go and visit Dr. Paz. He's got cutting edge technology to get them where they can be at their at their top performance.
Mm-hmm. I can just see this being such a promising thing, but again, it's not getting any publicity. So thank you for bringing Dr. Paz on here today. Again, if you have questions about this and the methodology, how about calling us at 855-297-9696? You don't have to use your own name. You can just call yourself some other name. Call yourself Luis today. 855-297-9696. Speaking of Luis, these programs are canned and put on YouTube, which is kind of cool, on the BCN channel. Yes, they have their own YouTube channel to watch the broadcast of these shows and other workshops that they may do.
What they may be fascinated to know is only for a short time now, they can actually see Rob.
That's a new technology. No, let's just call that a new freedom. Earlier, I was under contractual obligation to not be seen facially on any networks or anywhere, right. And now that contract has ended. So I can now be seen along with my buddy. And we're going to do a TV commercial together, aren't we?
We should. I absolutely
got to dress up one day.
I know. I couldn't even take a picture with you and show my friends.
You
were on lockdown.
But I'm telling you right now, I'll have to dress up because you're dressed up all the time. I'm usually in a T-shirt and sandals. All right, we're taking your calls again at 855-297-9696. Dr. Paez is with us, and the company is called South Lake Pain Institute. And how about your website and your phone number, Doctor?
So easy. It's just the same as our practice name. It's www.southlakepaininstitute.com.
All right, let's get John on the air if we can. John, what is your question for the doctor, please?
Yes, good morning. How are you? And I apologize in advance. I've got my 2-year-old sitting behind me in the car right now, so she may have a question or comment of her own. My question is, I'm a retired professional athlete. I was a cyclist. And I've had a few issues with my menisci, my ACL on both my right and left knee. most of them from blunt force trauma related to car accidents or crashes. Most recently, I've had an incident, a work-related incident, where I blew out what was my good knee, partially rupturing my ACL and having a meniscus removed about 60% of my lateral meniscus. I started researching the stem cell injection, and I got scared because some of the naysayers were discussing how there's a risk or an increase in cancer throughout the body for people who use their own stem cell. Have you seen any hard data on that?
Yes, I'm glad you bring that up, John. The research has been done already, and there has been zero studies showing that there's an increase in cancer. All the data shown that cancer will not be spread. What we do for patients is we definitely screen them, and if there is a history of cancer or a known cancer, we don't proceed that way. But in a patient like you, we're going to take cells that are inside your bone marrow that still have not differentiated into cancer. As a matter of fact, there's research out there showing, I don't want to talk about this because we don't have data yet, but there's research out there showing that it may change the genetics of those cells that are already transforming into cancer. But let's not get into that. But it's safe. It's safe to be injected anywhere, and you will not be propagating cancer as long as we're not taking a leukemia patient from or leukemia cells from their bone marrow.
All right, we're going to take a break. We're going to come back. We have 3 more callers on the line. Also, our texting is open at 21232. If you're new to that technology and you're saying, I've never heard of that, well, what you do, this is a Mogreet computer that takes your text from your phone and puts it into computer form. Kind of neat. Not to another phone, but to our computer. So the code to get in to contact is 21232. 21232. No charge on our end. Your supplier may charge you to text, but no charge on our end to do that. We'll be back with your calls and more. And it's the BCN Law Firm sponsoring Law 2020. Reach the BCN Law Firm at bcnlawfirm.com or 855-LAW-2020, 855-529-2020. We'll be back. We are back, and it's Law 2020, and Wade Boyette, who comes in here and anchors the show most of the time, likes to let people in Central Florida know other things besides just the law. So sometimes he brings in special guests. They're very community-oriented, the BCN Law Firm, very, very plugged into the community, and so they always try to supply the audience something that when the audience walks away from the show, they're really walking away with some really cool conversation, and they're further educated. The law firm can be reached at 855-LAW-2020 or 352-394-2103. BCN Law Firm has offices in Lakeland, Claremont, Winter Park, and the Villages. You don't have to go through a gate to get to the Villages office. It's in the Santa Fe office building on 466 and a new satellite office in Sebring. And we're taking your calls right now at 855-297-9696. Let's go down to Gary. Gary, how can we help you? What is your question?
Yes. I have a brother with Parkinson's. Has he done any stem cell work in that area?
Well, we haven't, Gary. We have not. We have not have a patient with Parkinson's, but our FLAC patient, remember, I don't know if you were listening when I said that our first injection was intrathecal to a patient with ALS, is essentially the same injection. The procedure will be identical, and the concept will be the same. Those cells will swim through the liquid that surrounds our spinal cord and our brain, and it'll go into his brain. And the theory is that it will go into the brain and grow neurons. Research in the lab have shown that we can grow neurons in the lab. So now it's the study. The research is very young for these things to tell you whether your family member is going to be helped. We don't know yet, but the theory is there, and the possibilities are endless. So definitely something worth trying in your family member.
Okay. Thank you, doctor.
Yes, sir.
How does the AMA and all these people stand on all this? Evidently, we're doing it, so.
Well, they know that we're doing it, and they always release these very neutral statements, and where they don't support or refuse the treatment, or they just don't want to make a clear statement. So you take these trailblazer doctors that are willing to take the initiative, and I must be honest, I didn't want to do it. I've been offered this for several years, and I didn't want to get into it until I came face to face with that patient that needed it, and I said, why not? Let me learn about this and let me start doing it.
You bet. Is this something else that's been being done in other countries well before us?
Actually, yes.
Usually?
We're behind on the research.
Most of the time.
Europe, South America, Asia, it's with most of the research is. There's some phenomenal things coming out of even the Middle East where there's less control about things. And there's a flag case of a patient that was paralyzed, and he's the family member of one of the sheiks, one of the rulers of the country, and his spinal cord was injected, and this gentleman is now walking after being paralyzed.
Think of what that could do for our soldiers. Dr. Julio Paez with the South Lake Pain Institute is with us today. He is with us courtesy of the BCN Law Firm. And let's continue with our phone calls right now. We may have to hold you through the break at the bottom of the hour, but let's go with Nate. Nate, what is your question?
Hi, yes. Just calling in. My girlfriend has scoliosis and degenerative disc disease, and the pressure has actually caused some nerve impingement. I'm just wondering if maybe the research you've done has any chance of helping her out to get her back up on her feet. She's been in and out of the hospital a couple times over the last couple of years here to kind of manage it.
Unfortunately for her, I'll have to see her, Nate, to be able to make a determination. But if the pain is coming from the compression of the scoliosis, that's a mechanical issue, and it's just like a bent wire, and it physically needs to be bent back and put in shape. So I don't know. Just without knowing her and examining her, I can't give you a definite answer. But if it's caused by the mechanical pressure, then stem cells will not be able to regenerate that injury or what she's suffering of right now.
All right. Well, as far as the disc growing back out to the size where they may be able to take some pressure off.
Well, we can help the disc, but if we help the disc and the disc regenerates and then the scoliosis goes back and bends it again, it all depends what the angle of the scoliosis. So I'll be delighted to take a look at her and tell you more after I've seen her MRIs and X-rays.
All right, very good. And we're down to about a minute and a half. I think we have time to answer Kathy's question. Kathy, you're on the air with Dr. Paez.
Okay. My fiance was involved in a bad accident about 5 years ago, and he has some disc damage, and he's had some injections, the epidurals with the steroids, with a really nice doctor. And I was listening to the stem cell research, and the question I was asking was if they're able to volunteer themselves with our medical team to see if he could have this done.
So if I understand your question correctly, Kathy, is about whether we can treat him and see if he'll improve. The research has already been done, and we're very aware.
1 minute.
But we're very aware that he could be helped with spinal issues and stem cells, so he can himself become a patient. I'm not aware of any research out there willing to take any patients, but once we know, we'll post it on our website.
All right, very good. And what is that website, Doctor?
SouthLakePainInstitute.com.
That's pretty simple. And BCNLawFirm.com. This whole show is brought to you by the BCN Law Firm. Law 2020. We got phone lines open at 855-297-9696. We'll be back. lot of energy in this show. This is Law 2020, brought to you by your friends at the BCN Law Firm. Offices Winter Park, Claremont, Lakeland, the Villages, and a satellite office in Sebring. Now, you could call them anytime at 855-LAW-2020. That's 855-529-2020. And BCN stands for Boyette, Cummins, and Nalos, all right? And it's bcnlawfirm.com. We've got a great guest today, and the BCN Law Firm is very, very, very generous with their time. They want to keep you up with all kinds of things, not always just the law. Dr. Julio Paez is with us from South Lake Pain Institute, and he's taking your calls right now at 855-297-9696, 855-297-9696. Basically, a procedure that's being done right here in our own area, but very, very little is known by the public about this at all. So holding on the line the longest right now is Mike. Mike, you're on the air. Go ahead.
How you doing, Dr. Paez? I was in a bad car accident a few years back, and my sciatic nerve was torn, and it ended up being fused to my spine. And the neurosurgeon was able to dissect it off the spine, but in chronic pain with nerve damage in my legs, and I have to be on heavy narcotics in order to relieve the pain. And I was wondering if there's any possible thing you can do for that.
There's plenty of things we can do for that, Mike. That's terrible pain. The sciatic nerve is very sensitive, does not like to be touched, tickled, pushed, or operated upon, and certainly you will be in a lot of pain after that. We can epidurals with stem cells or intrathecal injections with stem cell will regenerate the area, and definitely we can take a look at that, and that's a condition that could be helped with stem cell therapy.
I have all my medical records.
We'll take a look at them, Mike. Come by the office. That is certainly a condition that we treat on a daily basis at South Lake Pain Institute.
Where is your office, by the way, Dr. Paez?
So we have two offices. Our main one is in Claremont, Oakley-Seaver, 845 Oakley-Seaver. That's where the VA hospital is, the same plaza. And we have a second office in Orlando, downtown Orlando, of 801 North Orange Avenue, 7th floor.
A lot of doctors in that area, I got to tell you that. All right, let's continue with our calls. Let's go to Rich. Rich, how can we help you?
Yes, I've had 2 back operations, and none of them have worked, and now they want to do a third one. And I got the first one, they put 4 metal cages in there, and the second one they put screws and plates and rods. And now they want to. They say my spine is like this closed up, and the nerves are making me like fall down and stuff.
Have you tried a spinal cord stimulator yet?
I've tried yes. I still got the wires in my back from that.
Well, we'll have to look at your MRIs. If you're falling down and you're having stenosis and compression of the nerves. That's a critical point in where surgery may be needed for you, but we'll have to take a look at the MRIs and discuss your symptoms a little bit longer. We certainly could make a case that stem cells would work for everything, but there are exceptions, and if a surgery is needed, then there's nothing you can do about that. In your situation, it looks like as if surgery is needed to preserve the integrity of your nerves, but we'll definitely have to take a look at the MRIs and give you a definitive answer.
All right, that opens up another line. I've got 5 open lines right now, so that's instant help for you, 855-297-9696, 855-297-9696. Sharky, you've been holding a long time. We thank you so much for being on the air with us. Go ahead.
Yeah, I just need to ask you a question about the stem cell there. I spent 20-some-odd years in military service. I've been flying for the past 60 years in good health, except I'm 82, and I've had a little bit of heart damage. Portion of my heart still doesn't affect my operation, but is there a chance that stem cell can be used to regenerate that portion of your heart that's been damaged?
It's a great question, Sharky. There's a lot of study coming out of South America and Europe We certainly do not treat heart conditions, but we're willing to do it, just like our first patient with ALS. And when you give the stem cells intravenously, most of them will go towards the heart and towards the lungs, and some of them will go towards the heart. And there's regeneration of patients with COPD, emphysema, and bronchitis, and certainly regeneration with patients with heart disease. So in your case, yes, the condition could be helped. The research is already out there.
Wonder, while we're lining up some other questions, Dr. Paez and Wade, why hasn't there been more publicity about this? I mean, you don't turn on the TV and see any shows about the stem cell research right now. Was the media not understanding the whole thing, and they think that it's all about the religious and the political views that were aired out about 6 or 8 years ago? I mean, that's pretty well past news.
I think there's some restrictions from the media. They don't want to get into controversial issues at this point, but also physicians are probably not willing to go out there and get the attention of the FDA. There are certain methods of harvesting the stem cells that are controversial, and they're open to the manipulation techniques that the FDA tries to regulate. So physicians don't want to create attention towards themselves.
But when you come along and you're using your own stem cells, it almost seems like, using your own blood after an operation.
But the FDA had something to say about taking stem cells from the fat tissue. So certain physicians are doing what's called a small liposuction and taking the stem cells live next to the vessels of the fat or next into the vessels of the bone marrow. So harvesting fat and then transforming it into stem cells, or you can harvest stem cells from there. But the FDA says that there's transformation of tissue. You go from fat to stem cells, and that's too much. So they have a saying on that, and we're still actually waiting for them to give us an official statement on the subject. And some people are obviously scared as to what could happen in the future.
All right, very good. Well, let's get back to the phones. We have rejuvenated an awful lot of people who want to ask about this. And we have Sylvia on the line. And Sylvia, you are asking a question for thousands of other people. So go ahead and ask.
Yes, I have multiple sclerosis, and as a result, I have difficulty walking. And I was wondering if having stem cell injections would help improve my condition.
Great question, Sylvia. The research is out there also in regards to multiple sclerosis and all of the neurodegenerative diseases, Parkinson, multiple sclerosis, ALS, dementia, strokes, because the idea is that the stem cell could regenerate into forming any cell of your body. So if we put it into the big problem is, where do you get your stem cells from and where do you inject them? So we take them from the bone marrow of the patient, which is your own safe. There's no chances of infection of any kind that you will get from somebody else's blood or stem cells. And also we have determined in our office that it's safe to inject it intrathecally and intravenously. So that will go safely into you and obviously go to the target for MS, which is your spinal cord and nerves outside of your spinal cord.
Did that answer your question totally, Sylvia?
Yes. Is it possible to have that procedure done? Or I heard you say something about research has been done already, studies have been done, but can anybody just get it done?
Yes, ma'am. What I meant to say is that research has already shown that there is some improvement on regeneration for multiple sclerosis. There are very few physicians that have that trailblazing mentality and willing to do it coming from a small practice. But our first patient, it was what we call baptism by fire, because our first patient was not easy. It was an advanced ALS patient, and we put the medication inside the intrathecal space, and we were fearful as to not if the patient was going to improve, but we didn't know if there was going to be complications. And this patient is doing fantastic at home. We still communicate with him, and he's doing well. No complications. So now we're very comfortable injecting the spine. We're comfortable injecting intravenously. So your condition, MS, is exactly similar as, or it's very similar to our first patient with ALS. So you will be a good candidate. All
right. Sylvia, if you want to follow up, and any of our people that are listening, again, doctor, your phone number and your website?
352-394-0833. Just let them know you're a patient interested in stem cells, and they will patch you up through a different line. And you can also go to our website, southlakePainInstitute.com. There is some construction on the website right now, so forgive us if it doesn't work properly.
All right, very good. We're going to come back with Cindy. We're going to come back with Teresa. If you would like to get in line, we've got time for more calls at 855-297-9696, 855-297-9696. The news crew is working hard today, and we've got 3 big things you need to know. Welcome back. The BCN Law Firm. They bring you Law 2020, and occasionally they like to allow some people to come on the air to give you some really neat information. They may be people that are affiliated with the BCN Law Firm, or people that they have just run into out there and think, this information needs to be heard by the public. So today we have Dr. Julio Paez with us from the South Lake Pain Institute. Again, 352-394-0833. If you want to call the BCN Law, we're also taking law questions this hour, and that is 855 Law 2020, 855 Law 2020, BCNLawFirm.com, BCNLawFirm.com. And let's get back to the phones. And let's see, holding the longest, I do believe, would be Sharon. Sharon, go right ahead.
Hi, my name is Sharon, and I have severe back pain caused by osteoarthritis of my lower back, which is causing, pressure on my sciatic nerve. Can that be treated with stem cells?
Sharon, osteoarthritis in the spine comes from the SI joints or the facet joints. Those 2 joints are very amenable to repair with stem cell therapy, and it's been done before. It's a very simple injection. It's something we do on a regular basis in our office.
Oh, wonderful. Thank you.
Yes, ma'am.
All right, very good. Let's move right on now, and let's go to Teresa. Teresa, how can we help you?
Hi, I'm good, thank you. And you? Thanks for taking my call.
Mm-hmm.
I just have a question for you, Doctor. It's regarding my nephew. He had a problem where they told him that his disc was wearing, and they inject some fluid inside to build the bone around the disc. And they were told him that they inject too much of that fluid, and the bone is knit around the spinal cord. At the moment, he can't walk without aid of crutches. He can't stand for a prolonged time. He can't lie. He can't sit. He's just in agony all the time. And I just wonder whether your treatment would be able to help with the stem cells.
As much as I would like to use stem cells to treat everything, this sounds like an issue with a bone that's out of place and needs to be shaved or put in a proper position. It seems like, without looking at the MRIs, diagnose or talking to the patient, it seems like it's a surgical issue more than anything. I don't know what liquid will make bone grow like that, but sounds like a painful case. We definitely can take a look. Even if stem cells do not help specifically with this condition, we are a multidisciplinary practice, and we have multiple therapies that we can offer if it's not stem cells for this particular case.
Okay. Is there a number that he can call you and make an appointment?
Yes, ma'am. 352-394-0833 is our main number.
All right, let's move on, and let's get to Cindy. Cindy, you're now on the air with Dr. Paez.
Hello. I'm just curious if this stem cell injections can be used for cancer patients.
No, unfortunately, Cindy, that's one of the contraindications. We don't want to use stem cells on somebody who has active cancer. It's been done before with somebody who has cancer that has been treated, and the person is in remission, but we don't use it to treat cancer. We'll treat some other condition, but definitely will be an exclusion. That is something we don't want to do. I'm glad you bring up what else cannot be used. So patients that have an active infection, patients that cannot stop blood thinners or anti-inflammatory medications don't make them more bloody. We can harvest their cells safely. Anybody who cannot tolerate being in a certain position for a short period of time to harvest the cells, and certainly people afraid of procedures and needles.
That is amazing stuff. Where do you see this going, Doctor? I mean, if you're looking at your crystal ball 5-10 years down the road, because you are doing a great deal of research. That's very impressive to us. Where do you see this going?
Well, the biggest challenge is thinking outside of pain management. Pain management is easy because most of the structures that we treat, we can touch or access very quickly with a needle. It's, for example, a patient with diabetes and a pancreas that's already died. So the big challenge is if you give the stem cells intravenously, they will all be caught into the lungs and heart and won't make it to the pancreas, so there's no regeneration. But if we can find the technology to drive those cells directly into the pancreas, remain in there and allow them to multiply, the pancreas will certainly grow. As they have shown in the lab, the pancreas will grow in a lab.
This is highly interesting. I hope you can come back and visit us again sometime soon.
If you guys invite me, we'll definitely be delighted to come back.
Okay, we're down to about 2 minutes to go. Wade, what's some of the stuff that's been crossing your desk this week?
We've been really busy. Like always, our transactional practice is booming. Estate planning stays busy with the Village's office. Real estate, the market's hot right now, so we're doing a lot of real estate closings. Our personal injury practice is picking up. Advertising does work. And, it's nice to drive traffic into our personal injury side of the practice, which we work a lot with Dr. Paez and his office there. Really every area is picking up. We're growing. We have 11 attorneys now and continue to add more to see if we can't be one of the major players here in the Central Florida area.
And what I really like about the BCN law firm is I did a show this week with Melissa on another station. We were talking about the fact that you all are a multifaceted firm. You don't come on the air and just talk about one thing all the time. It's not always about personal injury. It can be about, you can handle that, but you also can handle divorce, end of life issues. And it kills me how many people are not planning for their demise or even for something happening to them to incapacitate them. It just drives me crazy, all that goes on with that. And again, so Dr. Paez, it's the South Lake Pain Institute. And you can be reached at 352-394-0833. I'll give it to you again, folks. 352-394-0833. And, of course, the BCN Law Firm. That is bcnlawfirm.com. Or you can reach them by phone anytime. 855-LAW-2020. 855-LAW-2020. And don't forget, if you are protected by an attorney, get yourself an association with an attorney now. Not when you need one. That way you're not panicking when somebody hands you that piece of paper, you get that thing in the mail, or somebody slips and falls on your back porch. You say, I'll just call Wade. He's my attorney. He'll take care of it. Give me another beer. All right, we're about done with this show. The experts continue on. Talon Financial Management up next.